So I'm now going to take you through a kind of case study. So I work with Stryker Medical. I don't know how many of you guys know them, but they make a lot of medical products. They're also one of the major joint replacement companies out there. And we worked with their orthopedics group. And they basically set out to redefine how knee replacement was done. We'll start with a quote from their CEO, which is what brought, I loved about these guys. The innovation culture at Stryker has changed dramatically. Providing clinical and economic evidence for new products has become critical. So right there in that statement, he's saying outcomes count, right? Outcomes count. We're starting to broaden our lens from just looking at products to thinking about the overall procedural efficacy and to think about the customer experience and the patient experience, i.e. customers are surgeons, right? Patients are patients. And we're starting to collaborate with customers and trying to understand what role we can play in assessing the overall continuum of care. So what they're saying is, what we care about is the outcome we're going to try to create for a customer. So the message in simple terms is stop focusing on the product, right? Start focusing on outcomes. What we want to do is figure out how we can return people to a healthy, productive lifestyle as quickly as possible. That's what everybody wants. Least amount of pain, least amount of money, best possible outcome. How do we do that? And so they brought together an innovation team that was pretty remarkable. I mean, top surgeons, patients, care providers, the people that do all the physical therapy after the process, engineers, software designers, user experience designers, all into an innovative team. And they sat down and said, okay, what's the journey through this for the surgeon, for the patient, and how can we now take some of these new technologies that we're seeing emerge and bring those into play to create services or new ways of doing things that better facilitate that outcome. So they could have just simply said, we're probably some of the top metallurgical scientists in the world work for us, the material scientist guys. We could have just focused on the joint and say, what can we do to make this articulate more, last longer, and so on. But they went well beyond that. They broke this value chain down and they identified areas where technology could make dramatic improvements, right, in the value that they were creating for people throughout this process and the final outcome. And so they didn't just stop at the joint. What they said was, because they've got data, right, lots of data to support this, it starts with the first dialogue that they have with the doctor about their pain. And so if we can teach the doctors to better diagnose, right, next step was imaging systems. If we can start to couple some of these high-resolution imaging systems into computer-assisted surgery, we can do a lot. If we can reduce the amount of surgical tools required in the operation, we can reduce the cost, reduce the pain, reduce the time. And what we know, the stats tell us, is if we can do that, except the patient does better in the long term than they would have otherwise. They put together an iPad for the surgeon, for the patient, for the care providers that said, here's the best practices. So they've got an application out there. They coupled in surgical tools, and they also went out and started to look at vendors who have got microsensors that they can install in that joint to not only help align that joint, but also give indication back to the doctor how that joint's doing, so that they can anticipate those things. And there was a lot more. But when you start to think about outcome-based thinking relative to what you're trying to do and the value you're trying to create from a customer, all of a sudden your lens expands dramatically. And so industry after industry that we're seeing, the innovative leaders are taking this approach because it divorces them from the product and focuses them on the outcome for the patient. So we're now about to go into the next part of this, but I wanted to tell a story because I think as we think about these things, this is important. So I was early on at Apple, as Wayne said, and I was the product manager for the Apple II. And we'd had a lot of problems with out-of-box failures. And so we went through a 3-month re-engineering effort, and we figured out how to repackage components, how to set the chipsets in there, and so on. So we reduced our out-of-box failures from probably 60% to about, like 3%. And so I was sitting in my office one day, and Steve comes walking down the hall, and he's got this big, our shipping carton that we redesigned. And it's a brown cardboard box. And I think, maybe I'm going to get a compliment. He throws the box on my desk, and he says, "Your out-of-the-box experience sucks." And he reached into his pocket, because I was smart enough to ask him what he meant by that, because I didn't know. He said, so he pulled out this beautiful little jewelry box, and he said, "When people get our product, I want them to feel like they're about to unveil this rare and precious gift." And he said, your box feels like you just ought to slice it open with a box opener and throw it away. He said, "That's not how I want people to think about us or our products." And so when you start to think about these customer outcomes, it's this ability to astound, delight, and amaze that we also need to keep in focus. And when you've looked at those outcomes, you now know where the value points are that allows you to create that value. So, if you look at General Electric, move this out of the consumer space, they're putting together a whole program where companies aren't buying their engine, they're buying uptime, right? And those things are tremendously instrumented with all this IoT stuff, but they're moving away from, buy my engine, we'll figure out the rest later. They're saying, no, what we're going to do is give you the ability to fly. Right? That's what we're going to do. So when we think about how do we create outcomes, that was just a telling moment for me in terms of thinking about customer experience. This is the first time I really thought about it outside of the keyboard. He said, so how many of you have Apple products, right? How many of you throw the boxes away, right? Most of us don't. Because they're beautiful, right? We keep them.
What do you do with them?
I leave them in the closet. I don't know. Well, actually, what I tell myself is when I want to resell it, when I'm ready to buy the next one, I'll get more money if it has the original package.